If you're a parent, I mean, you know the struggle is absolutely real. We're talking about that tiny, brightly colored, but just surprisingly stressful battlefield. Early childhood dental care.
Right. It's just a minefield of information. You get all this advice. Some of it's basic. Some of it is, well, frankly, panic-inducing.
Exactly. So our mission for this deep dive is pretty straightforward. We're going into a comprehensive guide for parents who just, need a shortcut to competence. We're pulling out only the high stakes, practical tactics, the stuff you need to survive everything from that daily 2-minute brushing negotiation to the sleepless teething nights.
And even the worst-case scenario.
Yeah.
That terrifying dental emergency.
Yeah.
And look, this material, it really goes beyond the basics. We're going to assume you already know you need a brush and floss.
Sure, we're past that.
What we're getting into here is more like, I don't know, special ops level instructions. We're talking precise mechanics, specific timing. So when a situation comes up, you can act fast and with confidence.
Okay, let's unpack this.
Let's do it.
Let's start right there with the daily grind. Brushing a toddler's teeth. It feels less like caregiving and more like trying to negotiate a hostage situation.
Oh, absolutely. And plaque, of course, does not care one bit if your toddler is grumpy or tired. The goal is always those 2 minutes.
But how do you get 2 effective minutes, when the resistance is just so high?
Okay, so first thing we have to tackle is posture. The way most parents do it.
Which is how?
Face to face with the child. And that gives the child all the leverage. They can turn their head, clamp down. You've lost before you start.
Right.
So the most critical shift you can make, and this is, it's genuinely a game changer, is mastering what our sources call the cradle hold.
Cradle hold. Okay. It sounds pretty intense. What does that actually involve?
So you stand behind the child and you let their head rest securely against your chest or maybe in the crook of your arm.
Oh, so you're approaching from behind, not the front.
Exactly.
Yeah.
And the point isn't just about restraint, though that is a bonus. It's about visibility and safety. When you stand behind them, you get this direct, totally unobstructed line of sight into their mouth. You're basically mimicking the position a pediatric dentist uses.
Ah, that makes sense. So you can actually see what you're doing.
You can see the surfaces you're targeting, yeah. You can actually hit the back molars, the gum line, instead of just, blindly scrubbing the front teeth.
I think what's so powerful about that is it just shifts the whole dynamic from the get-go. You're in control. Now, what about the soundtrack to this whole process, the screaming?
Right, the protesting.
Our sources say something that feels completely counterintuitive. They say to use the screaming to your advantage.
Exactly. Don't waste energy trying to quiet them down. If they're yelling what's happened,
Their mouth is open?
their mouth is wide open.
Yeah.
That little window, however brief it is, that's your opportunity.
So you just jump in.
You leverage that moment. Maybe you have a very short, specific brushing song, or you let them hold a toy they only get during brushing time. The key is to see their protest as the very access you need. Get in, hit your targets, get out.
And when you're in there, what are you actually doing with the brush? Because my instinct is always just this frantic, wide scrubbing motion.
And that's what we all do.
Yeah.
But you have to abandon that. It's
Yeah.
too abrasive, and it's just not efficient.
Okay, so what's the alternative?
We shift to what's called the two-tooth rule. This is all about micro-precision.
2 teeth at a time.
Just 2 teeth at a time. You're just wiggling the brush, gently but firmly, in small circles, and then you quickly move to the next pair.
Huh.
Think about it like cleaning a delicate surface. It's the small, directed motion that works, not some big sweeping gesture. By focusing on just 2 teeth, you make sure you're getting the surfaces people usually miss, but you also maintain speed.
Speed and precision.
They are the absolute keys to getting the job done before that toddler wins the battle and clamps down.
Okay, let's move on. We've won the daily 2-minute battle, but now the teething nightmares.
The sleepless nights, yes.
It's an exhausting phase. So when a tooth is erupting beyond, the usual over-the-counter pain meds, what can parents actually do to survive?
Well, the sources are really consistent on this. In many cases, the simplest, most accessible remedy is also the most powerful one.
And then that is?
The frozen savior.
The frozen savior, I like it.
You just take a clean, wet washcloth, fold it, pop it in the freezer for about 30 minutes.
Yeah.
You want it stiff, but not, rock solid. And then you just offer that.
Wait, hold on. Why a washcloth? What about all those expensive gel-filled teething rings you see everywhere? Isn't a washcloth too hard?
It's a great question. It's all about texture and sustained counterpressure. Those gel rings. The liquid inside warms up really fast, so they lose their numbing effect.
Oh, I see.
The washcloth, though, it has this unique sort of fibrous texture that lets the baby really gnaw and rub the gum line effectively, and the cold lasts so much longer.
Okay, that makes a lot of sense.
And if you combine that with a second technique, just simple manual counter pressure. Wash your hands really well, and then use a clean finger to just firmly massage the gums right where the tooth is coming through. That pressure, it kind of distracts the nerve endings from the pain. It feels amazing for the baby.
This is where we need to make a really critical distinction for parents, right? Because it feels like we blame every single infant problem on teething.
Everything. Crying, not sleeping, you name it.
But the sources are crystal clear on the medical boundaries. Teething is not a fever over 38 degrees Celsius.
No. Nor does it cause diarrhea or a widespread rash. If you see those symptoms, that's a call to your GP, not the dentist.
Exactly. But when should you call the dentist? Are there mouth-specific signs?
There are. You should call if you see these deep purple blisters on the gum. They're called eruption cysts.
Okay.
They're basically just little blood blisters from the pressure. Usually they resolve on their own, but it's good to get them checked. And definitely call if the child is refusing all food for more than a full 24 hours.
Oh.
That could be a sign of something more serious. Right. Okay, let's pivot to the next big dilemma. Thumb sucking.
The thumb-sucking dilemma. Yes.
It's so natural, right? It's a self-soothing thing for babies.
Yeah.
But there's a timeline where it goes from being harmless to a real dental concern.
And that timeline is what's so fascinating. In the first couple of years, it's fine. Totally harmless. The problem is when the child moves into what we're calling the danger zone.
The danger zone.
Yeah.
When is that, and what is the actual risk?
We're typically looking at around ages 4 to 5. That's when the permanent teeth are getting ready to erupt. And the risk isn't just the thumb being there. It's the chronic, vigorous sucking.
So the pressure's the problem.
The pressure is the entire problem. That constant force against the roof of the mouth and the front teeth, it can literally narrow the upper jaw. And it pushes the front teeth forward.
Creating buck teeth.
An open bite, or more commonly, buck teeth. The intensity and the frequency of the sucking are actually more damaging than just the duration.
So if you see this happening around age 3 or 4, what's the strategy? Do you go straight for the bitter nail polish? Not at all. Punishment-based methods, they just focus on the symptom. They don't address the underlying need for comfort.
Right.
The best strategy is gentle positive reinforcement. Start around age 3 or 4. Use sticker charts, maybe a special activity as a reward for not sucking during, say, story time or in the car.
And if that doesn't work,
if the habit is still going strong past age 5, despite all your gentle efforts, that is when you talk to a dentist or an orthodontist. They might recommend a specific, non-harmful appliance to help break the habit.
okay. Now we have to talk about the scariest scenario, a knocked out tooth.
The code red moment.
It's a code red, and our sources hammer this home. For an adult tooth, you have a critical 30-minute window to save it. Preparation is everything.
And the first step is to immediately distinguish between two very different scenarios.
Yeah.
The required action is totally different.
Okay.
Let's start with scenario A. It's a baby tooth that's been knocked out.
Right.
The instruction here is simple and absolute. Leave it alone. Do not, under any circumstances, try to put it back in the socket.
Why not? I mean, my instinct would be to try and stick it back in.
Because the permanent adult tooth is developing right underneath that socket. If you try to force the baby tooth back in, you can cause serious permanent damage to the adult tooth that's waiting below.
Wow. Okay, so what is the action plan then?
Control the bleeding with some gauze and call your dentist right away to make sure there isn't any other damage, like to the jaw or lip.
Got it. Now, scenario B. An adult tooth gets knocked out. This is the 30-minute race against time.
This is the race. Okay, step 1, find the tooth. And this is crucial. Pick it up only by the crown.
The white biting part?
The white part. Never, ever touch the root.
Yeah.
The cells on that root are what the dentist needs to reattach it successfully.
Okay, I have the tooth by the crown. Step 2.
If it's dirty, you have to rinse it. But only for a moment, and only with specific things. Milk or a saline solution.
Milk. Why milk? And why is regular tap water so dangerous here?
That is the core of the whole 30-minute race. It's about root cell viability. Plain water has the wrong osmotic balance. It doesn't have the right mix of salts and sugars. It causes the delicate cells on the root to literally swell up and die almost instantly.
And once they're dead, the tooth is gone for good.
It cannot be reimplanted successfully. But milk, or a saline solution-like from a contact lens case, it maintains the viability of those cells for that short window you have.
Okay, so the tooth is rinsed in milk. What's step 3?
Step 3 gives the best possible chance of success. If you and the child are calm enough, the best place for that tooth is right back in the socket it came from.
You put it back in yourself.
You gently push it back into the hole and have the child bite down lightly on a handkerchief to hold it there while you rush to the emergency dentist.
What if that's just not possible? The child's in shock, it won't go in.
Then you have to use an alternative storage method. Store the tooth in a small cup of milk. Or, if you have nothing else, you can tuck it inside the child's cheek, in their saliva.
Saliva works too.
Yes, saliva and milk are infinitely better than plain water. Just do not scrub the tooth, don't wrap it in a dry napkin, and get to a dentist inside that 30-minute window.
We have covered so much ground today. We went from daily tactics, like that strategic cradle hold, to identifying these long-term risks, like thumb sucking, and then finally preparing for that absolute worst-case scenario.
That critical 30-minute protocol.
With the milk and saline, yeah.
When you pull it all together, what's really striking is the surprising effectiveness of simple, accessible methods.
That's a great point.
It really raises an important question, doesn't it? How often do we overestimate the value of these sophisticated, brightly packaged gadgets, the fancy teething rings, the expensive tools, when a simple frozen washcloth or, a carton of milk are actually the most scientifically effective solutions?
Knowledge trumps gear.
In this case, it absolutely does.
It's a great reminder that the solutions are often already right there in your home. And for you, our listener, here is a final provocative thought to mull over. We talked about the critical specificity of that 30-minute window for saving an adult tooth. If the risk is based on the death of those root cells from being in the wrong environment, how long could those cells survive if the tooth were kept in a perfect environment, like one of those commercial dental preservation fluids? What's the physiological limit that stops us from waiting, say, 24 hours?
Something to explore further.
Something for you to explore as you deepen your knowledge base.
Until the next deep dive, stay informed and stay vigilant.
We'll see you soon.